Welcome to the Crescent City, where Vital Options is in New Orleans with ASH, the American Society of Hematology. You're sitting with two noted advocates from prominent organizations representing the disease type that you deal with. What do you need from the advocate community?
I would say that we need three things in order to achieve this vision. One is more research. So, first we have to describe better and understand better what the problems are. The second one is that we need education. And it's not just for patients and families, but actually for my oncologist colleagues and also for my palliative care colleagues. We need to better understand each other's work. Unfortunately, sometimes there's distrust and misunderstanding that leads to a lack of cooperation and collaboration, and we need to be better than that. And lastly, we need advocacy. And I think if agencies like yours can continue to advocate for the importance of concurrent palliative care as part of the care of patients with hematologic malignancies, that's probably the path to success.
I think, Dr. LeBlanc, that's a perfect closing thought. Thank you. Scott, your closing thought.
Great education. A great discussion. I think it is important. At LLS, we do a great deal of both patient and professional education. I think that is important. I also think one of the commonalities that we do see in cancer across, blood cancers and solid tumors is it does affect more than just the patient. And this is one of those important issues because you raised the question earlier about when a patient says, I want to stop, I want to get off this train. Sometimes that's driven by a particular place the patient is in right now, dealing with side effects, dealing with other emotional challenges, dealing with the challenges of whether it's children or caregivers or loved ones. And there's a lot going on in the ecosystem around there. And as an organization, we are certainly committed and focused on educating all and being there as a resource and a support for all, whether it's through First Connections programs, opportunities to kind of bring people together who have been there, because we think we can help patients through their journey. But ultimately, you're right. You want to empower the patient to say, you drive this. And again, like I said, you tell us what better means to you, and we'll help you get there. And we'd certainly love to continue working with you on professional education and patient education too.
Meghan.
The Lymphoma Research Foundation's mission is to eradicate lymphoma and serve those touched by this disease. And the primary way in which we serve members of the lymphoma community is to provide education and support. Certainly cancer care planning is an integral piece of the support that we seek to provide. And it's really, from our perspective, about arming patients with the information that they need so that they, their families, and their health care team can make the best possible decisions for them. Because as you've pointed out and we've discussed here this morning, it's a very individual and personal decision, but we know that these cancer care plans can be a very important resource for these patients and their families. And it's certainly important work that our organizations will continue to advocate for, and together with talented investigators who pursue this line of research, it's certainly our hope that even more patients will be able to take advantage of this incredibly important resource.
Thank you to all three of you for bringing perspective to this really vital subject.
Thank you.
Thank you.
Thanks for having me.
Pleasure.